G'day hikers, and welcome to the 2020 Hike to Highlands Virtual Festival. My name is Tom Wilson. I'll be your host today. Today's topic is travel and trip planning for international trips. My guest is Miss Denyese MacDonald. She has been a participant of Hike to Highlands Festival for the past 2 years. She's an RN working in Halifax on a surgical unit providing cancer care for patients. When she's not at work, she's often dreaming, planning, and getting ready for adventures abroad. Welcome, Denyese. My first question today is, could you give the audience, our listening audience, a little background on your trips that you've done abroad?
Of course. My interest in traveling started very early in life. When I was growing up, my parents and I traveled to the States every 2 years. We would often take our car from Nova Scotia and drive to Florida and be there for a few weeks. But we also traveled to the West Coast, and that really nurtured my interest in traveling. And since those formative years, I've traveled much more. I've lived in France for about 9 months. I worked as a field au pair for a French family. And while I was there, I backpacked Europe. I had the chance to take 2 service learning trips, one in Eastern Europe and the second one in Cuba, both focusing on agriculture. I was studying agriculture at the time. I've traveled extensively the last 3 years within Central America, and earlier this year, before things really took hold of COVID, I had the opportunity to go to South America for the first time.
Wow, interesting. So the next question I'd like to chat about is it's really important when you're traveling abroad to do your research, to understand the safety precautions that you may experience. So can you tell me how you kind of look at that and plan your trips in terms of like South America, Central America, all that stuff?
So whenever I'm planning a trip, my first resource that I go to is the Government of Canada's travel advisory, and I'll read through the website for that particular country I'm planning to visit. I tend to put a lot of focus on health and safety. So in regards to health, there's oftentimes recommendations for vaccinations, hepatitis A, B, measles, typhoid. So I look at what's recommended and see if I have those vaccinations or if I'm needing them, and then I speak to my healthcare provider. Also, am I visiting an area that has malaria? Will I need anti-malarial medication? Also, I look at what other illnesses are there: yellow fever, dengue, Zika. So I just keep that in mind when planning, and I do a lot of my I guess vaccinations, healthcare prep here in Canada before traveling abroad. And then in terms of safety, I look to see what's going on in the country. Are there demonstrations? Is there civil unrest? What about crime? What should I be thinking about? Fraud. I do spend a lot of time reading on those topics, and I do start with first the Government of Canada, and then I will look at other websites, because oftentimes I tend to be a solo traveler along with being a female traveler. So after I spend quite a large amount of time for my research doing that, then I look at other things like going on travel blogs and seeing what other travelers have done and what their experiences have been. So I have a well-rounded view of what traveling would be like in that country.
Okay. So in the last 2 years, I experienced a number of episodes with problems with traveling. And so a lot of us invest now in trip cancellation insurance as well as medical insurance. I'll give you an example. Craig mentioned yesterday that he was riding his bike in Florida and accidentally must have hit a bump or something and fell off. and he had to get 2 stitches and a few other things. And the bill came to 42,000 US just for a couple of stitches and being in the hospital for about 8 hours. So he said, Tom, that's the first thing I always buy. And he said, he mentioned that it was 1,000 deductible. So all he had to pay 1,000 and then the insurance paid for the rest. Do you buy that? Do you buy trip cancellation and medical?
Medical for sure. I think it's essential when traveling abroad to have medical insurance. Trip cancellation, I'll admit I haven't, but I think as um, uh, being more cautious with traveling, I would, just because you can't always prepare for the unexpected. And it's good because if something happens, then you're covered. And there actually was a time where I thought, ooh, I might be having to eat this one. So I arrived a few minutes late at the Halifax airport. I was flying to Belize, and at the time I thought that, because I was flying first to Toronto, I thought that domestic flights, I thought I had 30 minutes before it closed, but they actually had changed it recently to 45. So I was about 5 minutes late. So when I had arrived there, boarding at the first gate was closed. So the agent said to me, like, I'm not sure if I'm going to be able to board you, nor will I be able to check your luggage. But in the end, I end up being able to register and board the plane, and my luggage made it. But there was a thought, is like, if I'm not able to get on this flight because of my own fault, then I'm going to have to be paying for another flight, and that would be not very comfortable in terms of my finances. But it was a learning lesson, is that you just have to be really aware of time. So I think going forward, yeah, I would have it, just because, like, what happens if if there was an accident en route to the airport and I'm late and I missed my flight and it was outside my control, but I would still be responsible for having to be there, but I couldn't. So I think it's the safer options to have trip insurance, so that you can't make it or you have to cancel, then you're covered.
Yeah, so bringing it in reality. So I had a trip planned to Scotland this year, and I was touching base with our travel agent just to be on the safe side, because once I heard COVID-19, I said, I better call to see if I can get trip cancellation insurance. And so I did call her, and she said, Tom, I think she called me back and she said, Tom, something is just coming up now. And she said, 2 companies that are two of the biggest insurance companies in the world have said they will not insure people traveling during COVID-19 because it's a worldwide pandemic. And they said they won't cover it. And the same thing happened back in 2010. We took a chance and we were lucky, but Iceland started having volcanoes erupting. And so you couldn't travel because of the ash in the air. The airlines just wouldn't travel. So lo and behold, just I think a week before we were leaving, they opened the skies again. So we were very lucky. But luck doesn't count some days. You really should be looking at investing in that stuff. So 2 years ago, we were leaving from Lerwick in Shetland, in Scotland, to fly from Lerwick to Glasgow. And it was blowing a gale and you couldn't see because of the heavy fog. So they canceled the flight. So all of a sudden you're starting to think, uh-oh, I'm going to miss my flight home because it's supposed to be the next day. And then you say, oh, I got to cancel my room. So everything was hitting you all at once. So we went to the front desk and they said, we will look after getting you from here to Glasgow. Oh, that's not bad. And said, we'll cover it. I said, that's good. So we had ferry from Lerwick to Aberdeen, and then we had to take a 3-hour taxi ride to Glasgow. So, but she said, you won't be able to make your flight the next day. Ooh. So then I called and I got the flight changed, and it worked out. There was one seat left in the economy section. So we got one of those, and then I had to buy the premium seat, which is sort of like first class, and so we got that, and then we had to book the accommodation and all that stuff. So I'll make a long story short, I went to the insurance company and I told them my case, and they said, we'll send you the form, fill it out, and we'll look after you. And they did. They paid for everything. So I would have had to pay, let's see, $1,500 or more to change everything, and they covered it. So I can really see the benefits having trip cancellation insurance.
Definitely. Like sometimes, like in the past, I had the mindset like, oh, I don't want to spend the extra money. But when you look at it, like in your case, where having to make new hotel arrangements and buying flights, like it really does save you in the end. So it's a good investment.
Definitely. So my last question, and this is probably an easy one for you to answer because you're working in the healthcare profession, is that now that you know, well, now that you pretty well know quite a bit about COVID-19, when do you think you would feel safe if you were traveling again?
I think I personally would feel safe once there is a vaccine. It's been proven to be safe and effective. I've been vaccinated, and COVID-19 is a memory of the past. As of right now, we are not in that situation, so I wouldn't be advising people to be traveling. I know the government of Canada right now has an advisory for non-essential travel. You mentioned before is that your medical insurance may not cover you if you were to travel right now because there's a pandemic going on. Also, too, I think there's a lot of risk with traveling. Like you're seeing countries open up, but then they're reclosing their borders because they're seeing a growth in COVID cases. So you're seeing that in tropical countries. I saw like the U.S. Virgin Islands. They have closed their country for a month, so they're not allowing new reservations. So like what happens if you were to travel there and then they close and then their borders, and then it's really hard to get home. You might not necessarily have access to essential services, especially if locals are trying to use those services as well. And I think as well too, just the uncertainty of everything. I don't think that would be make for a very enjoyable trip. So I think it would be best to wait until we are in a better place with COVID and the fight against it.
Yeah, now Dr. Tam, our Canada's public health officer, said a couple nights ago on CBC that even if they develop the vaccine and it's proven, public health is still going to recommend using masks and social distancing for at least 2 to 3 more years. What do you think about that?
I'm in agreement with that. We know that those two measures are very helpful in controlling the spread of COVID, and I think that's realistic. Yes, we're thinking that by 2021 we're going to have a vaccine, but then it's going to take time to produce a vaccine and then to distribute it and then to have a vaccination program in effect. And then in the meanwhile, you might have other waves of the virus while people are being immunized. So it's the fight against COVID is not going to be done once there is a vaccine. Like it's still going to take time before it's available. And you're also you're having countries compete against each other to have the vaccine. So, you know, for everyone in the country, or the majority of people in the country, to be vaccinated, it's going to take time. It's probably, you know, at least a year and a half. So in the meanwhile, while people are waiting for the vaccine and being vaccinated, we still need to be vigilant against the fight of against COVID, and wearing our mask, washing our hands, and maintaining social distancing. And if you're feeling unwell, staying at home, being tested, and doing all we can to protect ourselves and others.
Yeah. So that's a probably, it helps me understand a little bit of what she said, that realizing that it's going to take a year and a bit maybe just to vaccinate everybody. That's one of the reasons why she said, don't forget to wear your mask and do your social distancing, because it's going to take a while before they get everything done. Well, that's great. So on behalf of the Hike to Highlands Festival Society, we like to thank you for joining us today and sharing your knowledge and your experience with international trips. And hope that you have a great summer, and we'll see you in the fall.
Thanks so much. See you in the fall. Glad to be part of today's panel.
Yes, thank you.